Several suspected monkeypox cases, a viral disease, have now been reported in Spain, Portugal, the United Kingdom and Canada. The United States was also the first to report a case of this virus. The outbreaks have now caused concerns as the disease mostly occurs in the west and central parts of Africa and only spreads elsewhere very rarely. In the US, the Massachusetts Department of Public Health confirmed a single case of the monkeypox viral infection in a man who had recently traveled to Canada.
So I'll just give a broad overview of the patient's admission so far. So the patient was admitted on the 12th. They were being evaluated for various symptoms. During the course of their admission, they were identified as a possible monkeypox suspect. And this was really unusual because the patient had no travel history, no exposure to animals that would be known to be reservoirs.
The World Health Organization was also coordinating with the UK and European health officials over the new outbreaks. This comes after Europe and Canada reported an unexpected spike in monkeypox cases. As per health officials in Canada, more than a dozen suspected cases of monkeypox virus are now being investigated in the Quebec province. The officials also added that the cases were flagged after they were diagnosed in several clinics specializing in sexually transmitted and blood-borne infections. Meanwhile, Spain and Portugal detected more than 40 suspected cases of the monkeypox and around 23 cases being reported from Spain, with about 20 from Portugal. The health personnel further noted that these infections may be caused due to sexual contact between gay or bisexual men. If proven, this could be a new discovery in understanding the transmission of the virus. British authorities have also detected at least 9 cases of possible monkeypox this month. The health officials also said that the patients needing medical care were put in specialist infectious disease units at hospitals in London and Newcastle. Monkeypox is a virus that causes fever, muscle ache and swollen lymph nodes before causing a chickenpox-like rash on the face and body. The virus got its name since it was first discovered when outbreaks of a pox-like disease occurred in colonies of monkeys that were kept for research. The virus has 2 main strains, the Congo strain, which is more severe with up to 10% mortality, and the West African strain, which has a fatality rate of about 1%. Monkeypox is rare but has the potential to be a serious threat. And now for more details, our correspondent Trent Murray is joining us live from Berlin. Trent, tell us about this growing concern across the globe now about monkeypox virus and the infections that are rising, specifically in the US and Canada. Is Europe worried at all? This, of course, was a disease or infection that was so far prominent only in Africa.
Well, I think Europe right now is watching this situation very closely. I think there's certainly an element of vigilance involved in all of this. But of course, we do know that monkeypox is an incredibly rare disease. And so it is unusual that it has now found its way to Europe. And what we know is that there is a lot of contact tracing going on now, trying to find what the source of it may be. Now, as you mentioned, currently, and I should stress these numbers, of course, are moving around as contact tracing occurs, but currently there is around 9 cases in the United Kingdom. It is thought one of them was imported, but the others don't have any travel history or any links, it seems, to the original case, and that is where the mystery is somewhat. Now, as you mentioned, most of those cases are in gay and bisexual men, a lot of them living in London, and it is a similar story in Spain and Portugal. Portugal has now got 5 confirmed cases, more than 20 suspected cases. Spain has got 8 suspected cases. Now, all of those people are presenting with skin lesions, but they are in a stable condition, we understand. But what is really unusual about this, as I say, is that so many of the patients, from what we understand, don't have a travel history. Now, to give you some context, in the UK, monkeypox has arrived there before. They've had 8 cases in the past, but they've always been linked to travel to Nigeria, where it is somewhat endemic, where monkeypox is present. It certainly seems in this case that at this stage, that isn't the situation. And so that is what is happening now. Both the WHO, Europe, and the European Centre for Disease Control are working to try and find out how this has spread. Is there a risk of it spreading further? It is worth noting it is generally a mild disease. It is infectious generally through large respiratory droplets, meaning there has to be some strong face-to-face contact or bodily fluid sharing. That is why it's thought many of these cases have originated via a sexually transmitted route, but that's all being worked out now as doctors and health officials try to work out next steps and, try to prevent it spreading further.
Right, Trent, thanks for summing that up for us. Thanks for joining us with all the latest inputs on WION World is One. WION World is One is now available in your country. Download the app now and get all the news updates on the move.